Hello, thank you for joining us today. My name is Cynthia Fernandez, and I am with Easter Seal Southern California. We are very excited to share information about alternative services, assistance, and training support that we have put together for all of you, otherwise known as the Disability Thrive Initiative. We are offering a Spanish and ASL interpretation today. For those in need of Spanish interpretation, please click on the white globe at the bottom of the screen labeled Interpretation. Then click Spanish, and you have a choice to mute original audio. You will then be able to hear Mark Gutierrez provide a live and simultaneous interpretation of this meeting. In the Spanish channel, if you select Mute Original Audio, you will only hear the interpreter. Otherwise, if you don't select Mute Original Audio, you will still be able to hear the English presenter in the background. Hola. Mi nombre es Cynthia Fernández y estoy con Easter Seal Southern California. Y les damos gracias por acompañarnos en esta sesión. Estamos muy emocionados en poder compartir información acerca de los recursos para servicios alternativos, también conocidos como la Iniciativa de Prosperar de Discapacidades. En esta sesión estamos ofreciendo interpretación en español y también en lenguaje de señas americano. Para los que necesitan traducción en español, por favor, oprima en el botón con el icono del mundo blanco que dice Interpretation en la parte de abajo de su pantalla. Luego, elija Spanish y tendrá la opción de Mute Original Audio. Esto eliminará el audio original. Entonces, podrá escuchar la voz de Mark Gutierrez, quien le proveerá la interpretación simultánea en vivo durante toda la sesión. En el canal en español, si elige eliminar el audio original, solo escuchará la voz del intérprete. Si no elige eliminar audio original, podrá también escuchar la presentación en inglés en un nivel más bajo en el fondo. Por favor, proceda con su elección. Our ASL interpreters are Destiny Bradford and Betty Moquina. They have both been spotlighted so they can always be seen throughout the presentation. Depending on your device, this may mean that sometimes you cannot see the presenter. We apologize for the inconvenience, but we want to make sure that this live meeting and the recording can be accessible to everyone. This presentation will have closed captioning available, which you can access using the button at the bottom of your screen. There are a few things to note about Zoom before we get started. This meeting is being recorded to allow us to refer back to the discussion today and the input we receive. You can hear and see us, but we cannot hear and see you. Unless you see your face or name on the screen, everyone has automatically been put on mute and your camera is not on. Chat is not activated for attendees. Presenters may be able to share some information throughout the chat during the webinar. If you would like to ask a question or provide comment, please use the Q&A feature at the bottom of your screen. We also ask that you indicate the presenter you would like to send a question to. We have staff monitoring and responding as necessary. Some of the questions will be answered in real time. Some will be saved for a live Q&A at the end, or we may ask you for your email address so we may follow up with you with more thorough answers after the webinar. For those of you on a phone or other device, you may not be able to use all of the features we discussed today. We will be providing other options for you to access materials or ask questions later in the webinar. Finally, at the end of today's meeting, we will be asking you to participate in our post-event survey. Once the meeting is over, a new window will pop open with the survey. Please provide us with your feedback so we can improve on future events. Now, it is my great pleasure to introduce Ms. Nancy BARGMANN, Director of the California Department of Developmental Services. Ms. BARGMANN is a fierce advocate for people with disabilities, and we are grateful for her leadership, especially during this time of alternative services. Ms. BARGMANN championed the statewide Disability Thrive Initiative we're launching for you today. And now I would like to pass the microphone to Ms. BARGMANN to say a few words. Thank you.
Thank you, Cynthia. And it is really my pleasure to welcome everybody to the Disability Thrive Initiative, the collaborative of organizations that have been selected to deliver alternative services, technical assistance, and training for individuals and their families and service providers across the state, for those individuals who are regional center consumers. So just by way of a little bit of a background, most of you are aware that in response to the pandemic and the limited nature of being able to provide services, we had to think through what was the best way to deliver services and support our community. The alternative services was designed to be responsive and to make sure services were available and to keep people safe. We also knew that there was a need to be able to learn from all of the great work that our community had been doing in being creative in delivering services in a very different way. And by way of all of those experiences, we were able to think and design an alternative services model that had input from a lot of the community to help us frame it in a way that was going to be meaningful and helpful to individuals during this very, very critical time. We had worked in partnership with San Diego Regional Center and released a request for proposal. And we were in the process of having the selection of one agent to deliver technical assistance that would be available to service providers, to families, to self-advocates, and to others in the community. But we found two remarkable organizations that we couldn't decide between the two of them, and decided that, you know what's better than one really strong contract? Let's go with two. So we went ahead and made the decision to go ahead and establish the two contracts, and are very, very pleased that it's resulted in this initiative that you're going to hear more about today. So the two selected was California Disability Services Association. It's an association of IDD providers, so those who support individuals with intellectual and developmental disabilities. And they have approximately 100 members throughout California. The second is Easter Seals of Southern California. As a service provider, they are also partnering with the Alliance of Leadership Education and the ARC of California. So both of these entities and leaders are going to be able to support you with technical assistance and training through December of 2021. The alternative services, as I've noted, is really important as far as being a benefit to the safety and support of delivering of services. We know that our COVID cases are going up, and it is something that COVID has kind of ramped up and kind of escalated. You know, we have concerns, so this is more important than ever in thinking through how to best deliver those services. And so I anticipate the alternative services and the need for technical assistance is going to be going into this next year, and super pleased that CDSA and Easter Seals and their partners are willing to work with all of us and partner in making sure that we have that support and training available. So I also want to really acknowledge all the great work that everybody has been doing over the last 9 months and providing those alternative services. It has been a bit clunky at times, but it's been very, very remarkable to all of the great partnerships that everybody's been doing to make sure that we were being creative. And when I say we, I mean all of you, everybody who is working to say, let's take a look at how we meet people where they are in a person-centered way and be responsive and do it in a way that is across the state in delivering services in this alternative way. Really looking forward to the technical assistance and the creative thinking that the groups will be able to deliver to all of you, but also to listen to all of the great work that all of our providers and family members and self-advocates have done in looking at ways to be a resource and to share their skills in assisting individuals in accessing alternative services. So as you move forward, I am just really thrilled about being part of the launch of the Disability Thrive initiative. And I think what's really intuitive of our partners that are providing this opportunity is that they came up with the terminology of the Disability Thrive initiative. And I really want to acknowledge that we're looking at this in a person-centered way and helping people thrive in the community. So we know that this is a very challenging time. It's not going to be easy. We still have a very big hill to climb. And we do look forward to making sure that you all are working together and accessing this as a resource to grow together and to learn how to best implement alternative services and meet individuals who we serve in the place that they are, whatever that need may be, and how we can best do it. So I do wish you all, we are in the holiday season. Again, I know it's hard. We're going to ask everybody to continue to stay safe. Please limit the amount of exposure that you have with each other outside of your household. Do access the supports that are available, and do find the joys and the share of joy during this holiday season in the best way that you can. And we'll look forward to learning from all of you over this next year, and look forward to a new year of 2021 with great hope and anticipation. So I am really pleased to kick this off and hand over the next presenter, I guess, or facilitator, Barry JARDINI, who is the Executive Director of the California Disability Services Association. And again, thank you for the opportunity to help welcome everybody and kick off the launch of all the work that you guys are going to be doing. So thank you.
Thank you, Director BARGMANN. Such a wonderful introduction to this wonderful initiative that we're going to be sharing more with you about today. I want to acknowledge the department, the Director BARGMANN, and then San Diego Regional Center for your partnership in this project, and just to let you know that we're so excited to have to be on this journey with you all. As Director BARGMANN said, my name is Barry JARDINI. I'm the Executive Director at the California Disability Services Association. We are a provider association representing over 100 providers throughout the state of California that provide a full range of services to individuals with intellectual and developmental disabilities. And we are just so blessed to be selected for this great project, as well as to be working with a number of great organizations and partnering with Easter Seals of Southern California to pull this off. And so today, my brief remarks will really just be focusing on giving a quick overview of the project of the Disability Thrive Initiative before I kick it over to my colleague at Easter Seals to share a little bit more. But I think Director BARGMANN's comments really speak to it. We wanted to name this initiative as something that really captures the spirit of what we've seen happen during this pandemic. We know it's caused a lot of heartache, a lot of pain, but there have also been some wonderful opportunities for people to find new service delivery models that work better for them, and looking and finding some new and novel ways to do things. So the Disability Thrive Initiative is really to highlight some of those best practices through the Alternative Services Framework to provide technical assistance and training to make sure that some of those innovative ideas, some of those best practices don't just get stuck with one or two providers throughout the state, that really we become a resource and a hub to provide that information to providers throughout the state. So we are going to be using a number of ways to share that information. The alternative services model, as we know, really was developed in a very innovative way by the department. I think, we sit on a number of national organizations as well, and I have to say California has really been very progressive and forward-thinking in how we can make sure that the individuals with IDD in California get served. And so this alternative services model is a way for us to empower safety, innovation, creativity, and make sure that we're delivering needed services in a very safe and effective way that meet the needs of the people who need these services. So the Disability Thrive Initiative is going to share these best practices, these creative ideas, in a number of ways, and I'm going to be touching on them. One of the ways, of course, is training webinars. You're on our first inaugural training webinar today, and I want to thank everyone for being here with us today again. We will be doing these on a monthly basis. There will typically be one or two webinars per month between us and Easter Seals, where we're going to be sharing a number of creative ideas on a variety of topics. You see them listed there. All of those topics are going to be covered through the lens of alternative services. So we're going to be covering this and making sure that we're sharing as many creative and thoughtful ideas as possible to give folks around the state new ideas for service delivery and methodology that they can take, or if you're a family member or an individual with IDD, you can say, you know, that seems pretty interesting. How can we kind of create that here? So that's something we want to do, is make sure that we're sharing that information, and these webinars are a great platform for us to speak to a lot of you at the same time. But we're also going to be doing some technical assistance for direct provider-to-provider training and resource allocation. So we have a ticket system that's being set up and will be hosted on the website, where all of our information will be kept. It's being hosted by the State Council on Developmental Disabilities. Certainly want to give them credit for their partnership in this as well. But that ticketing system will allow providers who are looking for more assistance in developing alternative services, who sometimes just want to bounce ideas off of those who've maybe figured out a way forward, so that we can help connect those folks with those consultants, with their peers, who can then share those best practices, and hopefully that will result in the delivery of meaningful services to more people in our system throughout the state. So we're really excited about pulling together a broad network of provider consultants who can help, who have worked to develop these meaningful services. One of the things we'll be doing is continuing to look for additional consultants to help build up our stable of great ideas that we can share. That's true both in technical assistance and the training webinars. So if you have some great and creative ideas and you're not connected to our networks, in any case, please reach out to us, Easter Seals, CDSA, or reach out through the State Council website. We'll have that on the slides later, to get more information or to share what you have developed. Finally, the last thing, and I just spoke to the website, we are going to be hosting a resource library that will capture all of the archived webinars that we do, all of the trainings. It's going to have the presentation materials that are developed by the subject matter experts. We will make sure that all those materials are translated into other languages as well. And as well as we'll be pulling in some external resources that might share some best practices from other states, different things, all to be kind of a one-stop shop for creative ideas around how to develop and deliver meaningful alternative services. So that's part of the package. I'm going to kick it over to my colleague at Easter Seals Southern California, Amber Carey Navarrete, to speak a little bit more about some of the other exciting things about the Disability Thrive Initiative. And again, thank you all for being here today.
Thank you so much, Barry. I really appreciate that. And I'm also really excited for this opportunity today to introduce myself and the Disability Thrive Initiative to all of you. I know each and every member of our initiative is so passionate about this chance to support our shared community during this time. As Barry introduced me, my name is Amber Carey Navarrete, and I am the Director of Person-Centered Services at Easter Seals Southern California. I also have the pleasure of being one of the project leads on this initiative. Now, Barry was able to share with you some of the main components we have in this initiative to offer you, but there's still more. I want to ensure that everyone has multiple support options available to them and multiple ways to connect with us. Slide, please. The first component I would like to share are virtual office hours. So you might come to find that you have questions about alternative services in general, or maybe leading off some of our webinars, but maybe these questions don't elevate to where you feel you need consultation or to request technical assistance. In those cases, what we have to offer are virtual office hours. So these will be ways for you to connect with our team live through Zoom links, and these will be starting in January. So you will find everything you need to know for the virtual office hours starting in January on the website that Barry mentioned, and we'll be giving you those details on just the very next slide here. But before that, I did want to mention that on this website here that you see, disabilitythriveinitiative.org. That is where you find the resource library. That is where you'll be able to find the discussion topics, the dates, and the times of the virtual office hours. So the times may vary because we really want theme throughout this initiative to be that we are meeting the needs that we are hearing you and our community have. So the times depending on that may vary a little bit, which is why getting familiar with the Disability Thrive Initiative website is going to be really, really important to stay connected throughout this time. Luckily, we want other ways for you to be able to connect with us aside from just virtual opportunities. And so as you can see here, we also have email and phone numbers. So just a simple info@disabilitythriveinitiative.org will connect you with our support team to be able to direct you to what type of support or options might work best for you. And you're also welcome to call these phone numbers for that same type of assistance. Next slide, please. So last, but certainly not least, we want to support your connection with each other. We will be hosting, based on your need and interest, virtual peer support meetings. These are a positive place to encourage each other to learn, brainstorm, and innovate together. A theme that we've been hearing so far in this webinar is creativity, and we all know that creativity is absolutely essential to successful alternative services. And I know for many of us, we thrive best in creativity when we have others to create with. And so that is why we want there to be more opportunities and more ways to connect, not just with us on the team, on the initiative team, but also with each other. So along these lines, I just want to say that the best part that I have found of this strange time we all find ourselves living through is the way that we have all pulled together, partnered with each other, and collaborated to make sure people receive their best services. I know our presenters during the second half of this webinar will be sharing their experiences with partnering and collaborating through these past 9 months. And I just want to mention how much I appreciate the partnerships we have developed within the Disability Thrive Initiative. There's CDSA and their project team, as you've already been introduced to, but also within our project team, we have partnered with the ARC of California and the Alliance for Leadership and Education to ensure that this initiative has a knowledgeable and diverse team to support you. So with that, I'd like to go ahead and hand the presentation next to Jordan Lindsay with the ARC of California.
Thanks so much, Amber. Hello, everyone. My name is Jordan Lindsay. I'm the Executive Director of the ARC of California. And it's wonderful to be with you all today and to kick off this campaign, this project that ultimately is here to try to meet your needs and the needs of the people you may support and serve, or your family, in better ways in this really challenging time. This has been, as Director BARGMANN has said, as you've heard others say, this has been a really difficult time. I don't have to tell you that, especially though for our community. And you may be hearing these words, alternative services, and you may be wondering, we have 792 people here, and I imagine many of you may be wondering, what exactly are alternative services? How is it going to impact my life? How's it going to impact my family? Will it improve our lives? How will it impact the people that I support as a direct support staff, or as a service provider, or as a regional center? So let's take a step back just a little bit and talk about where we've been. And just for the last minute, you know, in the first few months of the pandemic, there was incredible focus in the community on just mitigating the immediate impacts, keeping people safe. Let's get some PPE out in the community to keep people safe. We need to move away from congregate settings right now, because we know that that is a way that the virus could be more easily transmitted. So we had to move away from certain things, and we had to mitigate really quickly. But individuals and families still needed support throughout that time, of course, and it was the obligation of many to provide that support, whether that was in person or in new remote formats. We are now entering a phase where we can move from mitigation and truly move into meeting the needs of people with a range of models and of services and supports. And our aim with this project is to highlight, as you've heard Barry and others say, our aim is to highlight some of those models that you can take advantage of and that you can implement, that you can try out, and hopefully, obviously, we can find ways that your needs and can be better met during this very challenging time. And it's a model that you can choose if you want to choose to do so. So I want to be clear that we also want to recognize there's some anxiety around this idea of alternative services, and our intention, and I don't believe the state's intention, is to make these types of supports your only option and to eliminate the services you are used to. But I do believe this is a chance to provide an alternative that may better meet your needs. So we just want to lay that out right at the beginning. We're not going to solve everything with this project, but we are going to present really powerful ways and tools that you, your family, the community, you as support staff, as providers, can find ways to meet people where they're at right now. There's no better person that I think could talk about this quickly for us than the next presenter, who is my friend and a really powerful advocate from the Bay Area. So I'm going to hand it over to Elizabeth Grigsby.
Thank you, Jordan. My name is Elizabeth Grigsby. I'm a consultant for this project, and I also work for Golden Gate Regional Center as a rights advocate. But I'm going to talk to you as the people that we serve. And these are challenging times. I know we're in a different time where everybody's unsure about how things are gonna be rolled out. But the first thing we have to keep in mind is stay on focus and remember we're all here to provide services for the people that we serve, to make sure they're getting the best services and support that they need to thrive in their community. Yes, it's gonna look different, but for providers, don't be scared. It's not going to take away any services that you're already providing. Think of it as adding additional services to what you're already doing. And if you look at it that way, it will enhance everybody's knowledge in the disability community. And we will be able to thrive and be successful at delivering best quality services available for the people that we serve. First and foremost, we are here for them. We're here to make sure that they are in the person, that they are in the lead of everything that they do. It's about them and it's for them. So thank you everyone for being here, and we hope the next couple of months when we really roll this out that you will find that alternative services is pretty easy. Now I'm gonna turn it over to my friend Lydia.
Thank you, Elizabeth. Terrific summary you provided from your point of view. I'm Lydia Missilides, the Executive Director for the Alliance for Leadership and Education. We support the adult day services community through technical assistance, best practices, and research, and work very closely with Easter Seals and have for many, many years. So I'm thrilled to be part of this initiative. And I feel like part of my role is also to bridge our IDD community with the older adult community that I have also worked with for so many years. So thank you all for the opportunity. And my job today is to provide you with a quick overview of where we are with community spread of COVID-19. I'm sad to say it's not good news, but I will leave you with some hope, as I think you also heard Director BARGMANN express as well. So next slide. The number of positive cases of COVID-19 is going up fast, as this slide shows. You can see that cases were high early in the summer and dipped down in the later summer and early fall. But since the middle of November, the line is going almost straight up with no sign of bending yet. And that means the virus is spreading far and wide in our communities. Next slide, please. California continues to also see an unfortunate, very high rate of deaths from COVID-19. Experts tell us this is the result of infections that came from Thanksgiving gatherings and also travel out of state and within the state. And again, the graph on the left, which is from the State of California's website, shows a steep rise in deaths, again, with no bending in the curve. And the number that you see here on the slide, 20,243, is from last week, late last week. The number today is 21,481. So just in a few days, you can see the deaths are increasing. And tragically, and perhaps not unexpectedly, 40% of the deaths in California have come from people residing in nursing homes. And this is in large part, as you heard Jordan say earlier, because of living in a congregate setting, and also because the vast majority of people in nursing homes are of an older age, and we know those adults are more vulnerable to the virus. Next slide, please. This surge in cases means that our hospitals and healthcare workers are really strained to the limit. Intensive care units for the sickest patients are full or almost full, and that's what this slide shows you. That is why the governor issued a new stay-at-home order affecting almost all of California. I saw a report this week that in LA County, there are only 100 available ICU beds for a population of more than 11 million people. That is scary as heck. Next slide, please. And when hospital beds fill up, it impacts access to care for non-COVID patients who may suffer from a heart attack, a stroke, a car accident, or violence. So that is why extra beds are being opened up in some regions, in former arenas and vacant hospitals and other places. But of course, this is not ideal for any of us, and shortages of qualified healthcare workers are happening today to work in these temporary places. So to help address the crisis, some non-urgent surgeries have to be postponed. Our health leaders are telling us the situation will get worse before it gets better. Next slide, please. But it will get better, and I'm going to talk about why that is now. You've probably heard about the Pfizer vaccine for COVID-19 that was approved just this last weekend in record time and is starting to be given to frontline healthcare workers and nursing home residents this week. And a second vaccine made by a company called Moderna should be approved this week and will add to the number of doses available for our state. And of course, this is wonderful news. However, while our State Department of Public Health has said that people in the community with pre-existing or complex conditions, and the elderly are a high priority for the vaccine, so are essential workers, such as people who harvest our food, work in meat plants, teach our children. There is a very long list of essential workers. And all we can say at this time is that our community will get access to the vaccine after healthcare workers and before the general public, but we don't know the timing in between, and that's still being worked out. Next slide. So as Director BARGMANN said and others, this is why what you are doing today is so important. While everyone is awfully tired of COVID-19, now is the most important time to continue to practice basic public health guidelines that I know you are all familiar with by now. And please listen to trusted sources of information that comes from the state of California, our public health departments at the state and at the local level, your regional center, and other people who you really trust have all the latest and most accurate information. And of course, we here, Disability Thrive, will bring you accurate information during these webinars over the course of this next year. I know it's frustrating when you cannot control people's choices about interacting with folks outside of their household, but every little thing helps. So please help your community members understand their risks and why it is important to continue to follow all of these public health measures that you see on the slide. Stay at home, wear a cloth mask, stay 6 feet away from people outside your household, wash your hands frequently, avoid touching your face, especially when you are outside of your home. If we all do these things, we will help keep ourselves, our loved ones, and our community safer until we get vaccinations to 70% of the people in our state. That'll take a little time, but we do finally see a path to ending this terrible human suffering brought on by the coronavirus pandemic. So I just want to close by saying we are all in this together, and together we do make a difference. Please stay well, be safe, and we hope to see you for many more of these webinars to come. Thank you. I would now like to welcome our next presenters, Andrea Kroom and Ben Praker with the INALLIANCE organization.
Thank you, Lydia. So I'm Andrea Kroom, the Executive Director of INALLIANCE. I'm here today with Ben Praker, our Program Director from the Placerville office. Next slide. INALLIANCE provides 100% community-based supports to over 400 adults with intellectual and developmental disabilities in the greater Sacramento area. We have an office in Sacramento, Placerville, and Wheatland. We provide independent living, supported living, and support employment and tailored day services, as well as community-based day services and community-based work crews. Next slide. So today we're going to focus on the shifting of our day service and our collaboration with other supported living agencies as well as families to continue to provide in-person necessary supports to the individuals we serve during this time. Next slide. So when the new stay-at-home orders hit in March, we all know we had to change how we provided services. We had a shift. No news to everyone here. So we took a moment and figured out, what do we do when all of our normal places close? We provide individual person-centered support. So what we did was we focused on the person. We knew that DDS had come out with directives related to alternative locations, and that we could potentially continue to provide supports to folks in home. So we used our person-centered approach and discussed the needs of the person. Small planning teams met with the circle of support. We discussed that services might look a little bit different. We had to look at everything through a COVID lens to ensure everyone's safety and comfort level of service provision. So we collaborated with other agencies and families as well as the person supported. Not there yet, sorry, still talking. We could offer trained staff and support. Can you go back? Sorry. So we collaborated with the supports needed, and we had to, of course, address safety. At first, it started with FAQs based on CDC, state, and local guidelines. which turned into specific safety protocols for each of our programs, our office, and if needed, for the individuals supported. Today, we have daily health screening for participants and staff with specific protocols for call-offs as well as COVID exposures. Folks wear masks and shields. We practice social distancing. All staff are equipped with hand sanitizers, disinfecting wipes for their personal and company vehicles. We encourage hand washing when coordinating with other agencies to provide in-home supports to folks who receive supported living services from agencies other than our own. We found that most of our protocols aligned. And if they didn't, we went with the most stringent. We have shared our protocols with other agencies to help improve the safety of everyone involved. We continue to reiterate the CDC guidelines. We've found that sometimes other agencies have additional requirements to reduce the risk of exposure, which do mirror the same as our supported living protocols. There might be additional sanitation in home, which does align with our protocols, so our day program staff support that. We have only 1 to 2 people from our day services work with folks in home to reduce the risk of exposure. Another agency had asked us to do a memorandum of understanding where we would provide our own PPE and provided a very strict outline of what supports we were doing, which we can abide by that too. I would say during this time, communication is the most important to maintain everyone's safety and health. We have had issues of protocol not being followed on either end, and we've come together to create a plan of how we're going to move forward and continue to work together. Okay, now next slide. Our current collaboration, and this is as of November. Our community-based day program supports 229 individuals, and we provided some in-person supports to about 150 people. We have over 30 folks that we supported receiving SLS, and we work with 6 different agencies. We've also supported over 70 folks living in family homes. And I know as things shift and move, we have accommodated people's comfort level of people in home, or moved in and out of different types of alternative services. And I do realize it might be a little bit easier as our program is a one-to-one community-based program. So we were able to shift our thinking in collaboration with everyone else. And next slide, I'm going to hand it over to Ben Praker, who is going to talk a little bit about what this looks like in the collaboration between SHAWNA and our staff, Peggy.
Thanks, Andrea. It's good to be here, everybody. I'm going to talk a little bit about our partnerships that we have here. I'm the director in Placerville for our community training program. And if you could put on that slide there with SHAWNA and Peggy, the next slide. SHAWNA is a participant that she's in our community training program. She also lives in with support from her SLS agency, North Star. Peggy is our staff here. She's been with us about 8 years. She also works with North Star. So she is, in the true sense of the word, she's a shared staff. We've been able to make this work pretty well without a gap in services when the pandemic hit, by working pretty closely with North Star. And before the pandemic hit, SHAWNA was working at the library. She had an adaptive dance class. She was heavily involved in community, doing all kinds of volunteerism. When COVID-19 hit, a lot of those places closed up. So we had to be creative, and necessity is the mother of invention. We had to come up with some things that SHAWNA wanted to do that would help meet her goals and keep her active, and live as normal as possible through all this. So we've got together and we merged all of our health and safety protocols with North Star, followed all of the CDC guidelines, wear a mask, wash your hands, social distance as much as possible. We kept Peggy in there. She was, we didn't change staff around. So we've been able to kind of merge this thing pretty well without any gap. And, our first endeavor is to keep everyone safe. So we had to, the first goal is to keep all of these, all of our protocols in place. So she's been able to do a lot of things now that, without this pandemic, she wouldn't have done. She's learned how to use her keyboard pretty well. She's pretty savvy with technology now. Her mother lives in another town, so she's been able to do a lot of FaceTime with her mom, which she really didn't do before. She does a lot of Zooming with her friends. In our program before the pandemic, she met with her friends a lot for different things, and now she does it with the Zoom. They do exercise. We do a face-to-face service with SHAWNA, but we do just stay near her home. She has health concerns that we don't really venture out very far in the community. We stay close to her house. She walks her dog with Peggy. So she's been able to be, pretty active. They do get on the computer and do a lot of educational topics. And it's just about being creative. It's just about putting our heads together and trying to figure out this whole thing. And it's worked pretty well. We share a lot of common aspects with North Star. We have a lot of the same goals, a lot of the same mission. Open communication is where it's at. And they're like family to us, so we've been able to kind of do this thing in a way that it helps people. And we try to normalize this, as much as possible with how we do things. So thanks for having us here. It's been great. I want to introduce Michael with Easter Seals.
Hi, everyone. Thank you very much, Andrea and Ben. My name is Michael Smith. I am a program coordinator with Easter Seals Southern California Day Services. Before I begin my presentation, on behalf of Easter Seals, I would like to graciously thank the Department of Developmental Services, as well as the San Diego Regional Center for assisting in jumpstarting the Disability Thrive initiative. Now, I'd like to share with you in my presentation how Easter Seals is staying safe, how we are motivating and staying connected with individuals we support. Next slide, please. So rewinding a little bit to when the stay-at-home orders we first began and they were first pushed out, there was quite a bit of confusion and concern and uncertainty. And if I could quote one of the individuals that we support, she said, "Mostly I was scared and mostly terrified. I didn't know what else to think. Like, what will happen after this?" Additionally, one of our parents mentioned that Easter Seals remained optimistic, always staying positive. They noticed the attention Katrina is getting and how she participates in virtual activities. Next slide, please. So what did Easter Seals do? Well, we adapted and we collaborated. We quickly identified our need to change as uncertainty was an obstacle to overcome, and we rapidly addressed it. Waiting for things to return to normal was never an option for us at Easter Seals. And one of our very first obstacles which we identified was our Easter Seals living options, which among Easter Seals, we have many other lines of services, but living options supports individuals living in resident homes. And due to the stay-at-home orders, living options needed extra staff to support individuals who were staying home like everybody else was. So therefore, Easter Seals Day Services reached out to our associates to provide temporary staffing when needed. And also at the same time, it gave our associates a way in or a peek into the lives of those individuals that we support. So it was making it easier for everyone to transition to the new quote unquote normal. Additionally, we were aware that there was in our industry a lack of PPE or personal protective equipment. And therefore, Easter Seals was able to secure a generous amount of PPE, which we not only distributed internally amongst Easter Seals offices, however, we also were able to distribute them to other day services in our local area as well. Next slide, please. We also work to understand the needs of people using our services, their families, as well as the home providers. Now, how do we do this? Well, old-fashioned trial and error. We used trial and error while welcoming and being responsive to the feedback that we were receiving. Essentially, our connection to families and participants did not change. We worked on developing a new method of providing our services. And one big aspect of this was, of course, the technology. We were training the people using our services as well as their home support staff. One of the obstacles that we did face when we started our stay-at-home orders or our remote programming was the fact that we discovered that many of our families did not have the means to connect with us virtually. And luckily, with the collaboration from Easter Seals along with T-Mobile, we were able to provide iPads where needed for our individuals and the families we support. Additionally, there were other families who were unfortunately not able to afford internet at home. Therefore, we also provided resources where families could sign up for low-cost internet. Next slide, please. So our execution, how do you say we did it? Well, on the right of your screen here, you can see a quick glimpse at our weekly virtual group activities. Every day, all of our participants, their families, and also staff in our group homes will be sent daily activities, featuring activities such as safety tips of the day, how to stay safe in the community, Zumba exercise classes, also focusing on self-advocacy groups and their meeting times. If I could quote one of our parents, she said, "We are provided with a choice of activities, which allows for independence and something for Brittany to look forward to. If an activity was of no interest to Brittany, then we worked together to find something that would work." Also, another parent mentioned that Easter Seals Zoom sessions have been an absolute blessing for Danny during these crazy times. We can't thank you enough. Next slide, please. So Easter Seals, we understand that keeping the daily routine and the structure of the individuals that we support was a main priority. And as I mentioned before, Easter Seals services remain the same, but the delivery method was what needed to be adapted to. And through encouragement and motivation, Easter Seals associates and participants kept in consistent communication with each other. We provided regular check-ins through the day. For example, morning phone calls. We understand that the routines were showing that they were changing. So a quick morning phone call to make sure everyone was ready for the day. We were introducing our daily activities for that day and not only recommending which activities we suggested, but in order to create a more person-centered environment, we were looking for feedback from participants as well as families to see what their interests were and what they were looking forward to doing that day. Also, we promoted spontaneous events as well as connecting to community and world events. Next slide, please. So in summary for our execution, or how do we do it? We began with surveys. Initially, when we started the remote programming, we sent out multiple surveys to gather input from those who will use our services, along with their families and home support, regarding ideas, interests, and availability. Now, the survey data was used to mold and create a person-centered virtual program for everyone. And therefore, today we have our alternative services and event planning check-ins. We delivered supplies when needed. And also we worked together to collaborate and change routines or schedules when needed. Additionally, we provided virtual support calls, helping users log in or tech troubleshooting when needed. Next slide, please. So let's fast forward to today, our results. And as you can see here in a couple of the photos we have up on your screen, we have joy, we have happiness. And if I could continue to also quote another parent, she mentioned that through the virtual tours provided by Easter Seals, it gives participants the opportunity to experience places that they would never see in person. Another parent mentioned that Adrian, her son, who is an Easter Seals participant we support, she mentioned Adrian has accomplished losing 10 pounds from his workout class that he loves. And additionally, in talking with Adrian, he mentioned to me that I love working out. I got muscles, Christopher. And Christopher, he's referring to his coach. Next slide, please. Additionally, we encourage others in the participants' home to join virtual activities. Now, what does that mean? Well, basically, in the beginning of our remote services, we were noticing that we were seeing brothers, sisters, cousins, also from our individuals who live in our group homes. We were seeing their roommates so interested in the activities that Easter Seals was providing, they wanted to join in too, even though they were not members of Easter Seals. So therefore, what we did, for example, those interested, we assisted in connecting their smart TVs so that everyone in the house was able to join. We also assisted home support for the individuals needing physical support, a collaboration. So we would arrange or rearrange our events at times that would work best for the individuals supported in homes, such as hand-over-hand assistance or support with iPad navigation. And additionally, I think most importantly, including myself, everyone, I believe, has become more tech savvy. As a colleague of mine mentioned when we first began alternative services, hey, maybe one day all of us will be YouTubers. Next slide, please. We also continued our focus on personal goal processes. We continued our increased fitness attention, our increased attention to vocabulary and communication skills. Furthermore, we strive to focus on self-advocacy. Easter Seals participants have formed a self-advocacy group who also meet with the North Los Angeles County Regional Center monthly to discuss important topics and make a difference for people living with disabilities. We also assisted with people planning and leading their own events in order to make the connection more personable. So instead of Easter Seals associates leading Zoom events, participants were leading their own events. We were also able to get a glance into everyone's home life in order to explore their interests, their other hobbies. And that would add to a more of a person-centered or a person-centered driven program. Next slide, please. So what's next? What's next for Easter Seals alternative services? Well, for example, we have a video library or a video on demand that we'll be looking forward to in the future. So essentially everyone who if they miss an activity or if they're looking for something to do on the weekend or on after hours, they would have a video library they can log in to browse numerous videos from past activities that were hosted. We also want to recognize outside collaborations that need to continue. For example, local transportation affiliates who at this moment, they are also seeing their unforeseen future. So in the future, we're looking forward to collaborating with these transportation providers to deliver self-guided materials for upcoming events. For example, art supplies, in order to make our connection with the individuals we support even that much more personable. We want to continue to the increase of variety of our events, the continued encouragement of people hosting their own Zoom events. We also want to increase and include online volunteer opportunities. And this is an area I really want to stress that Easter Seals, before the stay-at-home order was into effect, Easter Seals was highly involved and committed to community outreach and community volunteer opportunities. So therefore, using the tools that Easter Seals has provided as a means to virtually connect, the individuals that we support can now travel the world, for example. They can take an online art class or yoga class, or even to volunteer by assisting virtually with a wildlife research project. Next slide, please. And this will bring us to the end of my presentation, but before I leave you, I would like to play a short video from a person we support to hear his thoughts on how he felt at the start of the stay-at-home orders and how he feels about his future. We could play the video.
Honestly, I would have been lost, but I know for the future reference, I knew that you guys will reach out to us and doing this Zoom activities with us. You also taught us to be confident in ourselves, to motivate ourselves, keep ourselves going, and also you guys allow us to express ourselves in our opinions. the one I would think like the one that really got me interested is like doing my own activity with doing like the exercise activity. I was like, honestly, like I was telling Brie, I was like a little bit nervous, like when you do like when you make your own Zoom activity, but at the same time, I feel more confident to knowing how to do it. I feel like you guys do so much for us, and also too, I feel like you guys motivate us a lot. You can always motivate yourself doing something different every day. Being motivated is just gonna bring us all back together, and bring us all back together in the end. It's a challenge that we're gonna take, but with you guys by our side, there's nothing that we can do.
Perfect, well said. And with that, I'd like to hand it over, I believe, to the question and answer portion of our presentation.
Thank you so much, Michael. I really appreciate that. And we do want to spend a little bit of time here. We are taking, a lot of questions have come in throughout this webinar. And so we have been collecting those and are going to spend a little bit of time here asking those questions of our panelists. So we'll go ahead and just go in order that you see here on the slide. So to start out, do we have any questions in regards to the Disability Thrive Initiative or any of our Disability Thrive panelists?
Yes, this is Will. So for Barry and Amber, can one of you speak to what's the difference between the Disability Thrive Initiative and the Department of Developmental Services regarding alternative services policies and procedures?
Amber, do you want me to jump on that one?
Sure, go ahead. Thank you, Barry.
Yeah, so the Disability Thrive Initiative is about sharing the best practices and innovative ideas that have been created, but we are not here to interpret or kind of give guidance on DDS directives or regional center policy. So we want to make sure that we're keeping it clear that DDS and the regional centers should be asked questions specific to any directives that have come out, et cetera. We are here as a function of trying to get those best practices that do fall within those directives out. So if you have questions, reach out to your community resources department at your regional center. If you have questions about alternative services, rates, those types of things, and they are the best place to direct your questions on that. If you have other questions for DDS today, we will be collecting those and sharing them with the department or with the regional centers as appropriate.
Great. I have another question. I'll throw this one to Amber. Are the local associations and/or contracts you're going to use to assist people have Spanish-speaking staff? And will all the materials be presented or provided in Spanish?
Great question, and the answer is yes to all of that. We do have members of our Disability Thrive Initiative team who are bilingual and will be able to support Spanish language as well as English. We also have made a commitment to translating all materials. In fact, even this webinar will be within the next couple of days posted in Spanish, Tagalog, and in simplified Chinese, as well as plain language, on the website that we have been sharing throughout this, the Disability Thrive Initiative.org. So we have made a commitment to make everything as accessible as possible. And if you have any ideas, tips, or feedback so that we can continue to do an even better job in this area, we would love to hear it.
Okay, and then the final one, and this could go to you, or we could throw it to Jordan and Liz if we wanted to. Will there be plain language information to explain alternative services to families and self-advocates?
Thanks so much, Will. Absolutely, that's a commitment from this project, similar to making sure that we are providing outreach to Spanish-speaking individuals as well as other languages. We're making a commitment in this project that materials will be in plain language, and that on the website that we post a lot of the information, like webinars and materials post-webinar, et cetera, those will be available in plain language as well. And in our time for peer-to-peer sharing and resource sharing, we really want to carve out a time for individuals themselves to share, and Elizabeth is going to be a big part of that with us, to share and discuss amongst themselves as well what's working for them.
And I'll throw one final question in for Barry and Amber. Is the DTI effort primarily aimed at adults, or is it really across the spectrum, including early infants or early childhood, all the way through adult services?
Amber, you want to take a crack at that one? I'm happy
Sure.
to as well.
Yeah, no problem at all. Our goal is to span the lifespan and all the different types of services. Anything that is under the alternative services umbrella is a topic and part of the community that we would like to reach out to and support. And once again, you as our community will help to guide this initiative. The more we hear from all of you what you need and what you want to find out from us, then we will get to work to make it happen. We can't promise to have all the answers, but we can absolutely promise to put in all the effort to be able to meet the needs of our community here.
Yeah, and I think just to build on that, we also are going to be guided by an advisory committee that's being put together that's going to have representatives from various service types, including infant services, et cetera, that are going to help guide us. It's going to have regional center representatives, DDS. It's going to have self-advocates, family members. So we are going to be getting feedback directly from that advisory committee. But as Amber said, we also want to make sure we're hearing from the community. So if you're not on the advisory committee, but you have anything you'd like to share with us, please reach out, and we will be responsive to the needs of the community. That's the only reason we're doing this.
Okay, and so with that, I'd like to now see if we have questions for Andrea, Ben, or Michael, our speakers in the second half of today's webinar.
I believe for Ben and Andrea, they've been answered, but it looks like there's quite a few questions coming in the queue. Michael?
Mm-hmm.
Do you have if there's questions for that team?
Okay, thank you. Yes, questions for Michael?
So I saw one that came in, Michael, that asked if you can give more examples of online volunteer opportunities.
Hi there, yes, sorry about that. So yes, the one I mentioned actually at the very end of my presentation was basically assisting researchers. We were able to go online and we were looking forward to, there was a platform that was set up for us where we were able to look at photos of specific animals and assist researchers in identifying the nature of the animal, where they were at, what they were doing. And that is basically the tip of the iceberg that what we're looking forward to in the next year in regards to volunteer opportunities. But aside from that, hopefully we are able to reach out to any of our local regular volunteer opportunities in our community that we can go ahead and see if we can connect with them again, reestablish that connection to see if we can assist them in continuing with their businesses going forward.
Thank you for that, Michael. I know that there was also a question that came in for you about, you had mentioned reaching out with surveys early on. And
Yes.
What was the participation and how did you encourage participation so that you really got a lot of feedback?
Yes, I mean, initially the participation was great and it's been continued to be great. The participants, of course, along with their families, were extremely excited. Overall, as I think we can understand that at the very start, everyone was very concerned. Families and participants and home support staff was very concerned that Easter Seals or other day programs would completely shut down. So I think that the main relief was a reassurance that we would be still active in some way or another. And as far as the participation, it was on a level, a different level by level from each family, each participant. But overall, the main strive that we're going for with our associates were to encourage and motivate. And from my presentation, I think you got a slight glimpse into some of the results that came from it.
Okay, thank you for that.
Mm-hmm.
Do we have any other questions from any of our Q&A monitors? Okay, then with
I
that.
have one more on that is, how do you sign up and direct the alternative services? Do you need approval?
No, you don't need approval. As we covered in the first half of this webinar that will be posted, and you can definitely review it again, as well as the slides be made available. The webinars are free. We will be posting them and you'll be able to find them and register and log on. The technical assistance and consultation is also free. The button, quote unquote, to get to it is also on the disabilitythriveinitiative.org website. So if you want to request that type of consultation, you just click on that button and you'll be able to register for it there. Also, the virtual office hours will have links as well as posting when and where and what type of things will be covered. Once again, so that we can reach the broad community, we will probably have certain virtual office hours that will be focused more maybe on children's services, adult services, switching it up so that we can once again meet the varied need of the community. And then anyone is welcome to email us. Anyone is welcome to give us a call and we will respond to you. Our great collaborative and partnership that we've created here. Part of the reason there are so many of us is so that we can be responsive and help everybody. But you don't have to get a referral. You don't have to get a request. You can just reach out and find us. So as you can see here on this slide, once again, we have the website information. We have the email address, one of the phone numbers, and then you can also, if you don't want to keep checking back on this website to find out what's next, what's the next webinar, all of that type of information, you can also follow us. We are Facebook and Twitter, Instagram, all the different services, social media services that you are most likely already on, and you can follow us there and then get updates as well to what's the latest and greatest in the Disability Thrive initiative.
This is Jordan. One question which I think is really important that I'd love for us to just spend a moment on, which a person posted, is with the increase in depression and anxiety, is there going to be alternative services available to meet this need? Mental health continues to be a big need. That is one of the things that alternative services and what we're going to be working on is exactly meant to meet that need. If you guys want to speak to that.
I would like to say one thing on that. It's really important now that we're all in this to really check on the people that we serve and see how they're doing about depression, anxiety, and so forth. It's really important to stay in touch with the people that we serve, and we need to hear from each and every provider and the community at large to let us know how we're doing so we can be more informative. It's only gonna work if we all work together. So.
That's excellent, Elizabeth. And I just want to add to that exactly what you said, Elizabeth, is that alternative services it's sort of being formulated, if you will. And so if you are an individual or a family, you have an active role in this as well. If you see a way that a need of yours can be met, especially if that's mental health needs, anxiety, otherwise, it's not just one way where now the regional center and the service provider say, this is what we can do for you. If you know of a need that you have, present that to your service provider or to your regional center and say, this is a way I can really be met. A need I have can be met. Can that be served under this new format of alternative services? You really have an active role in this. We encourage you to do that and work with us on that as well.
Absolutely. Thank you so much for that, Elizabeth and Jordan. And do know that also you can keep in touch. If you go onto the website, you can also sign up on our emailing list, and then you'll also be updated to the latest and greatest that is coming that way as well. Next, final slide, please. So here you can see some of the topics, including mental health. I know it doesn't say that specifically, but I know when we were talking about COVID-19 in our community, a lot of the discussion was around mental health and alternative services role within supporting mental health. So as you can see here, we have a lot of topics coming in the next couple of months, and there's a lot more to come. Once again, we haven't filled out for the whole year yet because we do want to hear from the community and find out what people are in need of so that we can make sure that we're finding the right people to be able to provide that information. But we, as you see here, need your feedback. So please follow us, hop onto the website, sign up for our emailing list, and keep an eye out for our January webinar posting. It will be coming out soon. So with that, I just want to thank everybody for your time here today and for attending. We look forward to hearing from all of you and seeing more of you in the future. Oh, thank you. And then for one final piece of it, sorry, Barry, before you jump in here, after, just as a reminder, there will be a survey that as soon as this webinar closes, it will pop up and you will have an opportunity to fill that out and you can start providing feedback right here and now. So we do hope that everyone takes a moment to do that. Thank you so much. Now, Barry?
Yeah, actually, you stole what I was going to talk about there, Amber. So thank you. Yeah, please do take the survey. Also, just thank you all for being here today. I know some of this was kind of giving a broad overview of the initiative. We do think it's important you understand what we're doing here. Also want to thank our presenters who shared from Easter Seals and INALLIANCE for some of the great work that they've been doing, the practical work, and that's the kind of stuff we'll be seeing more of going forward, and that's what you'll expect from us. So thank you all. Be well. Happy holidays, and thanks to everybody who worked so hard on this.